the projections in North Africa and the Middle East were quite large, and this was due to large increases both in population growth and population aging. And so these two demographic factors, in particular in that region, drove these large anticipated increases in dementia burden. So this is really something that governments and policymakers in these countries need to be aware of in terms of planning for the numbers of people with dementia that we anticipate to be living in these places in the future. We expect dementia, the number of people with dementia, to increase in every country globally, regardless of the world region. So this is an important disease to consider in terms of future planning, no matter where you are. It's just that the magnitude of those increases does vary. So for example, in Japan, where population aging has largely already happened, or is, has undergone more population aging than many other countries, that is less of a factor, and the expected increases are of a smaller magnitude. But overall, we still do need to consider the importance of any increase and preparing for the needs of this population, as well as any potential interventions and future research that can help us.
In academia, we talk about population pyramids, where you've got, the broader base at the bottom being the younger people, the young generations coming up, and as they die off, the older populations. But we've got a very disfigured population pyramid currently. So there's this sense of pressure upon health and social care systems of how we're going to look after this aging population. But it won't continue to grow at this rate, because as those older populations die off, we're seeing fewer people in each of the subsequent demographic age tiers. I think we must bear in mind that these are projections. These are based on, statistical modelling, and there is always an element of alarmism in these, because they can be quite politically emotive papers for governments to sort of take heed of. In Europe and the sort of Western world, their response to managing risk factors from a very early age on, we're now starting to see a decrease in the numbers of some dementias, such as vascular dementias. So the sort of health promotion elements of managing risk factors is starting to have an impact. Now, we won't be able to manage, we only know some of the risk factors for dementia. Some dementias will occur through reasons we don't yet fully understand. Healthy diets, lower alcohol intake, stop smoking. So there's this sort of mantra: look after the heart and you'll look after the head. Plus also, there's been great strides in how we manage cardiovascular disease that affects the brain. So stroke management, for example. So, the sort of antithrombolytic agents are being administered much more rapidly. So we're seeing a reduction of the functional damage caused by some of these transient ischemic attacks or strokes. So hence, down line, we're seeing a smaller, a smaller number of vascular dementias.
Please breathe in, breathe out.
If it's confirmed, then you can start to learn to live with it and to do something about it and to engage in certain activities. So that's sort of been paralysed a little by the pandemic. But also for those people that already have a diagnosis of dementia, the pandemic has equally had a profound effect. So, for example, their peer support groups, their social networks, their social care interventions were all stopped because it was seen as non-essential. Yet we're actually starting to see that those people with dementia and their families have been very negatively affected by that. So in some instances, people with dementia have declined more rapidly because they've not had the activities and the interventions. And family carer burden, carer distress has massively risen because they're very much on their own. They're very isolated now.